Some of the subjective benefits of bioidentical hormone optimization for women specifically are increased energy, increased mental clarity and cognition, better sex lives like better libido, better sexual lubrication and responsiveness, better sleep, and easier to manage periods, meaning their cycles tend to get regular and shorter and less cramping, less bleeding, and definitely less PMS symptoms. So things like migraines and irritability and breast tenderness and carbohydrate cravings and water retention and all of these symptoms that women experience to different degrees in that premenstrual week will subside, if not go away completely. We also help women navigate the menopausal transition. So those symptoms are often like night sweats and hot flashes, vaginal dryness, mood swings, and erratic cycles. We can help bridge that woman over and through menopause seamlessly without having to deal with those types of symptoms. On the longevity side of bioidentical hormones, the benefits for women that we can't necessarily appreciate subjectively, but that can be measured via blood work and DEXA scans, are things like reduction in risk of cardiovascular disease. And this is actually a really big deal because 1 in 2 to 3 women in the United States die of cardiovascular disease. So things like heart attacks and strokes and atherosclerosis. There's decades of research on the benefits of bioidentical estradiol for reducing risk of cardiovascular disease, and obviously, lots of studies. So the average range that we see in most of the studies is anywhere from like a 52 to 90% risk reduction in acquiring cardiovascular disease. And that is a game changer. Also a reduction in risk of osteoporosis, which women in menopause will lose an average of 20% of their bone density. And this leads to issues like, fracturing a hip, and the mortality within a year of a hip fracture is 50%. So half of women will die within a year of fracturing their hip. So obviously anything we can do to prevent that in the first place has huge downstream implications for a woman's health and functioning. Another one is a reduction in risk of diabetes. Hormones help women regulate their blood sugar. And that's a big deal, obviously, with diabetes and weight gain. But also in functional medicine, Alzheimer's disease is called type 3 diabetes because we know there's such a strong correlation with blood sugar. And helping a woman regulate her blood sugar will help reduce risk of weight gain, diabetes, and Alzheimer's disease. Another huge benefit of hormones is reduction in risk of certain metabolic cancers. So breast cancer being one of those that we see a reduction in risk of acquiring breast cancer with bioidentical hormones. And this is in direct contradiction to the studies using synthetic hormones that actually show an increased risk in those things. So it's important to distinguish or differentiate between what type of hormone you're taking for that reason.